At MPHA, we ask ourselves every day what it will take to create healthy, just, and thriving communities. Of course, we all need and deserve access to quality healthcare. And yet, good health doesn't start or end in the doctor's office. 80% of our health is created within the social and structural conditions where we live, work, and play. Imagine a society where everyone has access to the building blocks of good health. Things like strong public health protections, clean air and water, nutritious food, stable, affordable housing, and reliable public transportation.
This is the Massachusetts we are fighting for.
As we each are working on these separate issues and separate campaigns on different areas, which is important work to do, I think that public health really can be the connective tissue that ties together a lot of the ways in which our work should be framed. And I think that it's both important because it's a smart strategic move, but I think it's also important because we can't really understand the causes and therefore the solutions without really seeing the broader public health effects.
What people traditionally think of as the environment, but that also includes the built environment, so cities, the buildings we live in, the places where we work, all how we get around, and all of those things impact health. If you break things down by demographic data, race ends up being an indicator of where the most toxic sites are likely to be, where polluting infrastructure is, and we know it's also where the highest asthma rates are, where the worst health issues are, and that's not a coincidence. It's the product of systemic racism, so they're intertwined.
In 2016, MPHA deepened our commitment to tackling racial inequities that stand in the way of health and justice. To this day, the MPHA Board Committee on Racial Equity and Health lead efforts to address the impact of racism across all our work. And our Policy Council ensures voices from the communities most affected by health inequities shape MPHA's advocacy and organizing.
When I log on to Policy Council meetings and I see people in all shades and colors and names that come from all places, and we're all really committed, and we're all doing different things within it. For me, it's just like such a promise of what could be. That's possible because of MPHA, because I'm learning more and more about how to engage more people. I think MPHA sets a table where we don't feel like we're competing with each other, but that we're cultivating and growing with each other.
Our work on racial equity prepared us for the greatest public health crisis of our generation, COVID-19. We knew that communities already experiencing racism, poverty, xenophobia, and other forms of systemic oppression would be hit hardest by the virus and its economic fallout. The hard lessons of COVID, opioid deaths, maternal morbidity and infant mortality, asthma rates, and other health outcomes underscore a single truth. The people most affected by health inequities have long been shut out of the decision-making processes that impact their lives and their neighborhoods. This isn't by chance, it's by design.
But we're part of the movement to change that.
Through my work with MPHA, I have been really impressed and inspired by how meaningful and deep a commitment it is to really being led by movements on the ground, and they really move mountains to make sure that that is the role that they're playing, and it shows in the way that the partnerships work and thrive.
We partner with communities to build the power to disrupt the systems that deny people the essential resources they need to be healthy.
For nearly 150 years, MPHA has been there, protecting the public's health and fostering collaboration across sectors. And today, this legacy propels us forward and ignites our resolve to continue to fight for health and justice in the face of evolving public health crises.
As we face new challenges, we are building on our foundation for an even bolder future, driven by community, grounded in equity, and committed to justice for all.
Together, we can make it happen.